travel isn't just about destinations. It's about the people you meet, the cultures you immerse yourself in, the stories you carry home. I'm Relebogile Mabocha, and on my travel feature, I take you on a journey beyond the guidebook. Each week, I connect with fellow travelers, insiders, and storytellers to bring you the heart of every place. Whether it's a hidden gem right here in South Africa or a dream destination abroad. Join me as we travel through conversations, memories, and inspiration. Listen wherever you get your podcasts.
Relationship issues,
Relationship talk.
on 702.
So we have been doing this biannual where we do a sexual health Q&A with Professor Shingai Mutambirwa, who is a urologist and head of department at Dr. George Mokari Academic Hospital, and Dr. Mpume Zenda, sexologist and OBGYN. These are top sexual health experts that I bring on the show in studio. In fact, this year, I said we must do it 4 times a year. Is this the first time we're doing it this year?
You've been gallivanting, Prince.
Yeah. Just come to work occasionally, okay?
We work.
I'm being
we don't
called
know
out
about, we don't
by
know
my
about you.
guests on my show. Okay. I want us to do it 4 times a year, so we must still do it. If this is the first time we're doing it, then we must do it again 3 more times. So I bring them in studio, and then you call in. You call in to ask them any question you have, right? Any sexual health related question. You can give us a call right now on 011-883-0702. You can send us a WhatsApp voice note on 072-702-1702. It could be about anything, guys, from contraception, STI screening, treatment, fertility related issues, sexual functioning, whatever you've got questions about. Maybe performance and pleasure, anything. Give us a call or send us a WhatsApp voice note. As I always say, I think sexual health is fundamental to our overall health and well-being as individuals, as couples, so we must take it seriously. Thank you so much, guys, for coming through. Prof and Dr. Zenda, how are you guys doing?
So good.
Yeah,
Good.
Excellent.
Haven't seen you guys in a while.
Yeah, we repeat.
But I'm
I was
glad
about to say, I'm like, can you come to work, please?
But I'm glad you guys are here. Because I've missed you. And
Missed you
I
too,
would
bro.
say to Sinazo, when are they coming? He's like, but you're not here next week.
Exactly.
Yeah, so I'm glad we're finally doing it. Okay,
for having
so
us.
I'm going to start as always with just some of the questions that we normally get that are some sort of common, right? And some of the questions that we got from the last time that we couldn't answer. I'll start there and then we'll get to the calls and the WhatsApp voice notes. And the first question that we have here that we compiled from the last chat is, how does age affect my sexual performance or desire? So both from a woman's perspective, from a
Yeah.
man's perspective.
So age is a really big deal. But over and above that, it has to do with how well also you have taken care of yourself in terms of lifestyle. If you're looking at in terms of peak sexual function, so to speak, on the basis of hormones and things,
Yeah.
fertility as well. In your 20s and in your 20s and early 30s, you're probably doing very well in terms of the levels of your hormones and so on. But there are other things that come to play, whether it is reproductive health. So, for example, pregnancy, that will affect your sexual health. In particular, when you start hitting above 35 years of age, then a lot of your hormones, nice hormones, your estrogen, testosterone, progesterone starts to decline. And this has an impact in terms of not just function in terms of physical, because yes, definitely, it decreases your energy, your libido and so on, but also your physical change of your body in terms of how you look. A lot of people, you'll find that you're not as, if you were doing 22 rounds, 2-3 rounds per night or per session in your 20s, your energy is not that much. The big thing when it comes to women is the perimenopause and the menopause phase. What I love particularly, and I hope a lot of women can take this, is that there is sort of like this juxtaposition between a lot of women tend to come to their own around that age, so above 35 or so. You start being comfortable, you start knowing what you want, which helps. That speaks to a lot to do with sexual intelligence and emotional intelligence in terms of how you approach sexual, or your sexuality. So you are more like sure about what you like and what you don't like. But on the flip side, your body is kind of going in a different direction in terms of things like lubrication, in terms of desire and your libido and so on. So it's always important to just take good care, take stock of what is happening to your body, where there are changes. Go and see a healthcare professional. Let's, whether we're thinking, hormone replacement therapies and things like that. And it's okay. Don't expect to be having the same kind of sex you were having in your 20s, in your 40s, in your 50s. But sexual pleasure in itself, you can enjoy regardless of what age you are.
Does it get better with age?
I think it does. I totally think it does.
She winks and says that.
Of course, she's only 20. That's right. Yeah. No, I think just to jump on what Mpume is saying is that I think we have to put it medically. With sexuality is a bio, psycho, social, cultural, personal affair. All of these impact on how well you're going to feel sexually. And so even though, like Mpume was talking about how females go into menopause eventually, the data actually shows that females' prime sexual activity is around the ages from 40 to 43. Just as they're entering menopause. Now, guys, our data is that we are best around the age of my sort of age, 18 to 22. I mean, your sort of age. Sorry, your sort of age. My bad.
Is that our peak?
That is our peak. Mainly because when we're doing the data, we're looking at the amount of length that we can, for how short it takes for us to get another erection, how often we have sex, that sort of thing, which is not just based on that, because on activity, because remember, you must, like Mpume was saying, it's about the way you feel, and sexuality is a mindset, it's the way you think.
Hold on, Prof. Are you saying if you're 36 now, your best days are behind you?
No, your best days are still ahead. But if we look at the data, why you guys between 18 and 22 are supposed to have the best sex is because of what we call a short refractory time. Now, what happens when we have an erection? A lot of blood just rushes into our penises and we get the hardness. Once we ejaculate, there's a hormone called noradrenaline, which is released, which causes our blood vessels to squeeze down, and then we need to wait for that noradrenaline to go away before we can get another erection. Okay. So, although guys think that we have multiple orgasms, we don't. We don't. Females do. Guys if in the 18 to 22 period, you can have a very short refractory period, like 5 seconds, maybe 10 seconds, but that's not multiple orgasms. But if you live long enough, I guess to go back to my real age, if you get towards about 80, the refractory period can be up to 30 days. And that happens as we get along. But there are things that we can be done. And like Mpume is saying, it's a lot about general health changes. The psychological stresses, because you must make sure that you see your psychologist if there's a problem. Go and see your healthcare provider. Try to make sure you don't get into illness and eat, not smoking and generally doing some form of sort of physical activity. Like you, I was impressed by your marathons. Well done, Brandman.
Okay, so am I on a good course?
You're on a good course. You're on a good course.
Tell me, you're calling us. Oh, let's start with Brenda first, calling us from Four Ways. Brenda, good morning.
Hello, Clement. How are you?
Good. Go ahead.
And hello to your guest as well.
Yeah.
Hi, Brenda.
Clement, Doctor, what I wanted to ask was that I've got a very low sexual libido. I hit menopause. I'm 48 years old. My period stopped last year, so it's about a year that I'm not seeing my periods anymore. But my libido is so gone. It's a disaster. I feel nothing. I lust for nothing. I don't want anything to do with sex, and it's so unfair on my husband because he's still very sexually active, but I'm not there anymore. And I am on HRT. I'm using TB leave right now. I've tried testosterone. My doctor got me onto a very low dose of testosterone that didn't assist. And my husband has been researching on the topics, and we found presentation from, I think, Professor Trudy or Dr. Trudy from the Gordon Institute. And I tried these vaginal tablets called Gynoflow. But nothing is helping at the moment. Nothing is working.
Okay.
Yeah, I'm just dead, basically.
Yeah.
Yeah. And
Okay.
it's not my husband. I assure him all the time. I try to say that it's not him. It's just like I've lost taste buds for sex.
Yeah. Oh, yeah, Brenda, thank you so much for calling us. Doc?
Yeah, that is such a common thing. And I want to say, first and foremost, chances are you're probably okay in terms of physicality. Your body sure, it's changed and it's transitioned into a phase of menopause. One of the big things that I maybe want to pose, and fair enough, Brenda, we don't have enough information to get into the details of your own individuality. But there is this thing when it comes to what we call sexual intelligence, which is, I made an example and I said, if you had to be thrown somewhere where you don't know and all you've got is 5,000 Rand, you can't speak the language, and now you suddenly have to figure out how to get to where you need to go. And that's what happens to us when our bodies change. You have done everything that you needed to do in terms of making sure that physically, so you've gotten HRT, which is hormone replacement therapy. You've gotten some testosterone, which is basically balancing out or trying to assist with your hormonal side. But the big thing is the attitude also we have towards what is sexual pleasure, what feels good to us. One of the big things when it comes to women is that we don't particularly function a lot on what we call spontaneous desire, which is I see and I like and I want, or kind of like relying on feeling like it for you to even initiate sexual intimacy. So one of the things that we have to kind of unpack, and I'm happy to do this with you individually, you know, in a consultation, but it's understanding that I think I've spoken to in our past conversations where it's like, if I said to you, Clement, would you like some chocolate? And you said, no, I don't feel like it. And then I say to you, just try. And then you take a bite and all of a sudden you're like, this is actually really nice. So don't be so hung up on how you feel in the beginning. Do the things that you need to do. Initiate sexual intimacy. Go on those date nights or and get into it. And by the way, just because you are now being sexually intimate, it doesn't mean you have to have penetrative intimacy. You can just go into it with the intention to have pleasure and do the things that you love and enjoy, and those that you don't, it's okay. It may not look anything like what it used to be, you know, in your younger years. And get out of your mind the idea that normal sex is going from I feel like it, I'm turned on, I get into it, and then I have an orgasm. Normal sex is whatever it is that feels good to you at that time.
And explore and try
and
other
explore.
Things. Brenda, I'm going to put you back to the producers and we will link you up with Dr. Zenda and maybe you can have a consultation with her. Thabo, you've got a question for the prof here. Good morning. You're calling from Johannesburg.
Yes, how are you?
Sure. Go ahead, brother.
Good. I just want to find out, does having too much caffeine affect my erectile functioning?
Okay.
Because obviously I had a bit of caffeine.
Yeah.
But now when I'm trying, it's not just doing the proper way.
Okay. Got you. Thanks, Tibos.
Yeah, no, the short answer is that caffeine directly is not directly involved with sexual dysfunctions, basically. It can be involved with blood pressure changes and such. But there's data to show that coffee particularly does actually improve some sexual function, and also doesn't. And it's not. We know it's not just the caffeine that's there. It seems to be other aspects to do it. Not in excess as well, because anything in excess is going to be a problem. But I think the bigger issue is probably as we get older is remember that there are going to be changes in your sexuality. Yeah. You must consider getting yourself checked because there can be some underlying nastiness. But I wouldn't say the caffeine should be the blame. The association is not the same as causation.
Okay, 20 minutes now after 11 o'clock. More of your calls and WhatsApps after this.
Travel isn't just about destinations. It's about the people you meet, the cultures you immerse yourself in, the stories you carry home. I'm Relebogile Mabotja, and on my travel feature, I take you on a journey beyond the guidebook. Each week, I connect with fellow travelers, insiders, and storytellers to bring you the heart of every place. Whether it's a hidden gem right here in South Africa or a dream destination abroad. Join me as we travel through conversations, memories, and inspiration. Listen wherever you get your podcasts.
Relationship issues?
Relationship talk.
On 702.
23 minutes after 11 o'clock on our relationship and sex feature this morning. Adult radio, just to remind you, no kids allowed this morning. We've got Professor Shingai, we've got Dr. Zenda as well, and they're taking your sexual health related questions. Whatever you want to ask them, give us a call on 011-883-0702. WhatsApp line is 072-702-1702.
Hi, morning, Clement. Pat here from Spayview.
just want to ask. I'm 60 years old. I turned 60 last year in August. Okay, I do a lot of gym for many years. I gym a lot. Here is the thing. Every day, around about 5 o'clock, just before I could wake up and go to pee or something, I'm aroused, like rigid. My third leg is like rigid every single morning. Not that I'll be craving for sex or something, no. But my third leg is like rigid. I know this thing used to happen when we were teenagers, when we wake up in the morning, then you see your third leg, But at my age, how possible is this?
Jeez, at 60.
Thank you.
60 is young.
You are blessed.
Wow, you are.
No, he's blessed, but he's blessed with the right stuff. Nothing wrong. For our purposes, there are 3 types of erections that guys get. One is the one that everyone thinks about, this psychological one, where you look at something and you want to have sex. That's the one that we usually use for intercourse. There's something called a reflexogenic erection. For example, even for example, paraplegic men, they're usually young, but they can still, 70-80% can still get erections. And what happens is if you pinch the tip of the penis or the inside of the anus, you get something called a bulbocavernosus reflex, sort of like the one, for the knee jerk, but it then can cause an erection as well, and it can be used for intercourse. And the third one is what we call the morning erection, the one he's talking about, which, by the way, is extremely common. It actually happens from birth. From every baby boy gets between 12 and 15 erections every day. These are the same erections. They're not used for sex. They're used to get oxygen into your penis, the spongy tissues. And they're if it's working like that, and we know that it's based a bit on the so-called man chemical testosterone. It's not really man, it's both men. But if your testosterone is low, you won't get these morning erections. If your testosterone is normal, you will get them. So obviously his testosterone's in good shape. He's exercising. The only way to naturally increase your testosterone is by exercise anyways. And exercise does, by the way, people don't get worried, is about physical activity. Any form of physical activity is good, including sex. Even sex.
Sex can be activity.
Yeah, anything.
Okay.
Yeah, so it's normal. It's normal.
Dr. Mpume, someone says, Clement, please may you ask Dr. Gaini there, why do I feel tight when I climax? My partner likes to play with me till I climax. Then he enters. I suppose she means penetrate, yeah? Mm-hmm. Then he enters, but for that moment, when I'm all tight, and then it's not comfortable anymore. If I ask him to enter before I climax, I lose the entire dance because I sort of reset. Is there an explanation to this? So when she climaxes, she says she's tired, but the partner likes to play around with her until she climaxes, and then he wants to then penetrate because she's tired. But she says that's uncomfortable then. Yeah.
It's perfectly normal because whilst there is a lot of blood flowing into your genitals in the build-up, especially when you climax, there is a huge physiological change in terms of increased heart rate, but also there's a tightening of your pelvic floor muscles as the climax is happening. So that's perhaps what is happening. I often say, even just like when we do something as simple as a pap smear, never ever try and get inside a woman whilst they are breathing in, because it's often there's a tightening of the pelvic floor muscles. And because that is uncomfortable. So it is important. I'm not sure what it is about the partner that he wants, and unless he's saying clitoral stimulation until she climaxes, finishes, and then he can go in. But whilst your lady is tightened up and breathing in, because there's like literally a contraction of muscles at that time, and obviously that's going to make it a little bit uncomfortable to get in while she's tight. Okay. So and the reality is it's probably just like a matter of seconds that he needs to just maybe wait a little bit, or if he is already inside, then it actually is much better. So just before she climaxes, then she should be going in.
All right, Johannes, you're calling us from Secunda. Good morning.
Please leave your message.
Okay, Johannes, we'll come back to you. Mohale, you are in Senton. Hi.
Hey, how are you, Clement?
Sharp, man. Go ahead.
Good. Just a quick one, man. I just want to ask the doctor that I've got a son who's about 27. He was born 1997 in Garangua. I think that's George Mokari.
Yeah.
He had a problem with this umbilical cord where it was like there was an operation at birth. Only to find that I think that operation pulled up his testicles. So we discovered very late that his testicles, they hadn't descended. Now, we took him to medical clinic, they did the operation, they were just bluffing, thinking that they can see them, but they just cut him, they did that operation, but they couldn't see anything. Now, okay, we let it go. But now he feels like he's not he describes himself as a gay guy. I don't know. I don't know what, he feels like he's not a man enough, and it just, yeah.
Does he identify as gay, Mohale? Does he say he identifies as gay?
Yeah, he said to me, one day he said to me, he's a gay.
Okay.
Said, son, what do you mean by that? Because your testicle hasn't come down, there was a wrong operation at birth, very frustrating, eh?
Okay, Mohale, I got you.
Yeah, the short answer, he's when we're in our mother's womb, our testicles develop above our kidneys, and in the last few months before we're born, they come down into the normal position. They have to go down there because they need a temperature about 1 degree Celsius less than the rest of the body to make sperm in the future. In about 1% of guys, it doesn't go there; it gets stuck somewhere along the way. And the problem is that if he's got undescended testicles, he's now 27. We can already guarantee he's not going to be able to father children directly because there's no sperm in his thing. Now, what that has to do with sexuality is essentially zero, because the point is that sexuality is based on many other aspects. It's not just the testicles, and he is still going to be producing the man chemical. The sperm get damaged by the heat, but not the testosterone, the man chemical from the thing. So I think don't blame the system. I think the main thing is that if parents out there look and find that their kids don't have testicles in the scrotum, they must remember that they must try to pull it down as soon as possible, because we try to get them down within the first year or two after birth, because otherwise they won't have problems with fertility. But this has nothing to do directly with sexuality.
Is there anything else they can do now? Is it too late?
It depends on what they're trying to do. I mean, I think what his main concern is about his sexual orientation, and I think that's a thing of personal choice. If he's 27, I think he must also have a discussion with the family and stuff like that. But as far as fertility goes, there are things that can be done, but it's usually going to end up with donor sperm. You can't get your own sperm from the person.
All right, it's just after 11:30.
Relationship issues,
relationship talk
on 702.
All right, let's continue with our relationship and sex feature. We are taking your calls on 011-883-0702. We're taking your WhatsApps on 072-702-1702. Let's go back to Johannes, who's calling us from Secunda. Johannes, good morning.
Good morning, Clement. How are you?
Good, Johannes. Go ahead.
Yeah, I'm calling 1069.
Okay.
I've got a BP problem, but it's not affecting me so much because in the morning I just run, but I got that I don't get the erection, and I used to use Cilias, but it's no longer working for me now. Sometimes Viagra, sometimes I use Viagra, but it's no longer working. I also sometimes go to men's clinic to get injection. Yeah. So when I want to have sex, I must just get injection. That's all. So I ask, what can I use so that I can go back to my normal.
And how old are you now, Johannes?
I'm 68. I'm going to 1069.
Okay, 68. Okay.
Yeah.
Just hold the line in case Professor Shingai has some questions for you. Prof, he's 68. Every time he has to have sex, either uses Viagra or has to go to the clinic.
I think, remember we said earlier that the best directions for guys between the age 18 and 22. After that, it's like wear and tear. We must remember that our bodies like machines. There's wear and tear. By the time a guy reaches 30, our testosterone level starts dropping. By the time we reach 40, about 50% of guys are going to have a problem with not maintaining an erection sufficient for intercourse. And by the time you reach 90, if you manage that, you're probably looking at about 70-80% of guys doing it. The point is that it's part of the process of life. And I think he's trying to reenact. I know a lot of patients come and they say, listen, I want to go back to I used to perform like this. I'm not a magician. I can't turn back the hands of time. If you're responding to these medications, the Viagras and Cialis, he's talking, they're a group of drugs called PDE5s, excellent medications. Actually, we've published on it, protects you from heart attacks, good stuff, works well. The injections he's talking about, you can get them from these clinics, but you can also get them from your medical provider. They increase blood flow, excellent stuff. If those aren't working, sometimes we have to add testosterone. Sometimes we have to use something called a pump that can actually suck blood into the penis. And if worse comes to worse, or best comes to worst, we can actually put an artificial penis in there with a pump that can actually give you an erection. But I think he's overthinking it. He's 68. I'd be surprised if he didn't have erectile dysfunction. And although he's stopped responding, I think the short answer for him is you go see his healthcare provider. The commonest cause for men not responding to these PDE5s is low testosterone. If we supplemented testosterone, it improves it. But the injectables are good. The tablets are good. The erection pumps are good. The prostheses are good as well. Okay. But I think he must stop overthinking it.
Okay, go check it out, Bright Johannes. Thank you so much for your call. So when you say you can put an artificial penis, how does that work? What happens?
There are two types for our purposes. Basically, the penis is made up of two spongy tissues which are covered by a fibrous capsule. And when we get erections, there's blood going into the spongy tissue. We basically cut open the fibrous part. We borrow out all the spongy tissue, and we put either a malleable prosthesis, which is rigid, and you go up, you can push it up or down. But there's also pumps where you can actually pump. There's a reservoir, and we can then use a pump to pump fluid into a reservoir in the penis, which gives great erections. And the satisfaction for those things are somewhere in the region of 90-95%. Okay. But the point is they can be a bit expensive in some of the medical schemes.
Okay. Dr. Zenda, Anonymous says, Clement, please can you ask Dr. Gaini, every time after the deed, I, as the woman, I get an infection. We went to see a doctor. The doctor says he is fine. I am prone to infection as I am diabetic. Nothing can be done. So what can I do to avoid infections as the woman?
Right. So the likelihood is that she's probably having a yeast infection, plus minus something we call bacterial vaginosis. This is not a sexually transmitted infection. This is purely a change or a shift in the pH. When you look at the natural pH of a woman, sits at about 3.5 to 4.5, whereas when it comes to semen in particular, it's more alkaline and it sits more in the 7.5, 7.8. So what generally happens is that either because of aging, in the perimenopause, menopausal area, or she already has mentioned the fact that she's got diabetes, which then makes her even more prone to yeast infections. Some of the simple things that she can do immediately after intercourse, there's nothing wrong with getting up, go to the bathroom, get some citrus soda, drink that, take an unscented wipe from front to back, and generally you'll find that settles things. Over and above that, there's over-the-counter antifungal creams or what we call pursaries that she can use. So it's just an understanding of, okay, your body has shifts in this way, and it's not something that is, it's not that serious.
Yeah. Yogurt, unsweetened, unflavored yogurt.
See, the yogurt doesn't really work as well. And one of the things that we looked at is the fact that the type of the bacilli that is inside the lactobacilli that is in the yogurt, it's more for your gut. But the benefit to it is that if your gut health is good, you find that it actually helps with your vaginal health as well. In the same way that eating well and avoiding things like alcohol, a loss of caffeine, lots of spicy foods, that will still come through and have some kind of an impact. So the healthier your lifestyle is, the better your vaginal health is as well.
Okay, there's a question here.
But no food on the vagina. No yogurt.
But okay, yeah, okay. Someone is asking this question. I don't know if they're male or female. Why do I sometimes cry after sex?
Maybe it's nice.
Yeah, cry with joy.
Yeah,
I think the one thing we know for sure that happens after sex in 20% of people is that there are only 3 erectile tissues in the body. One of them is the penis. Second is the clitoris, which is exactly the same length and exactly the same organ as the penis, in many ways. Mm-hmm. And the third one are the nasal cavities. And so when we have orgasm or we're taking some of these medications, you can get a stuffy nose. because of it's just an erectile tissue, and that might be causing the crying. But like you say, I think Mpume's correct.
It's tears of joy too.
Yeah. Also, I mean, particularly for women, we get a big dose of oxytocin, which we call is the love hormone. So there is a sense of emotional that plays with it. It helps us bond better. That's why we want to cuddle and so on. So maybe somebody who's more, in touch with their emotions, it's like, oh my gosh, that was.
It's good, basically. It's good.
Here's a voice note.
702. Good morning, Clement. Can you please ask from the doctors if imbiza, the traditional medicine, ukuchatha, ganjalo, does it help in terms of bringing back sexual libido? Luvuyo Krasmer.
Okay, thank you for that. Here in Imbiza, someone help me.
Yeah.
Is it traditional? I think it's stuff. Yeah. Because there are guys who will go, women who, I mean, when you go to like places like Thailand, especially in Asia, I mean, how many times do you see like the yoni, what. So obviously you guys, that's not your area, but would you advise for people to try that?
The short answer is if you want to, but
some of them are dangerous. You're seeing a little paper advertisement on the side of the road.
Those are not even the ones. Those are doing some other things as well. But actually, as a shout out to my mother, her PhD was actually based on the same on traditional medications. It was published about 40 years ago, and in it, she actually they investigated. First of all, most of the imbizos and things are used more for gut health rather than from the sexuality, and the chemical analysis of most of these things, similar to the yoni, to the Spanish fly, is there's a chemical in most of these things called cantheridine, which is actually a toxin. It actually causes irritation to various mucosal in the body and stuff like that. And it also causes irritation to the pipe for passing urine in our body, which then can cause the same reflex erection, which can help in some guys, but it can also cause liver failure. It can also cause kidney failure. And we don't know what the dosage is. And so I always tell guys, if they're comfortable and they're happy with what they're doing, that's cool. But I don't know what's in it, and I wouldn't guarantee it. I'm a researcher, so I would say I'd avoid it if possible. But if it's working for you, hey, I think it might be in the mind, but it's also, it does have a physical part as well.
All right. It's 12 minutes now before 12 o'clock.
Relationship issues.
Relationship talk.
On 702.
9 minutes before 12 o'clock, we're wrapping up our conversation with Professor Shingai and Dr. Gaini. Any sexual health related question that you have. Let's start with you, Tsepo, in Limpopo. Good morning.
Morning, Clement. How are you?
Hey, Tsara. Shosho, what's your question?
I just wanted to find out. I thought that for females, coming is a feeling, Bobo. But now, with asking for a friend, their partner, whenever they come,
whenever they come, they do what?
They pee or squirt.
Okay.
So this is all the time. Like, I wanna lamahal. So before I tell my friend to pat himself on the back, is it normal? That is. That
is it normal? All right, got you, Tepa. Pat yourself at the back. Dr. Gaidi?
So it is both a physiological response as well as the experience of that euphoric pleasure when they come. Now, when it comes to in terms of squirting or them having pee coming out, it could be one of two things. Yes, we definitely, as females, do get something similar that comes from what we call Skin's glands. But that is in very small amounts, like about 15 mils of that. If she is coming and having like pools of, wet the sheet kind of fluid, chances are there is urine in that as well. And that's also because, especially during penetrative intercourse, the bladder literally sits just right behind or above the floor of the inner vagina. So the likelihood of somebody releasing urine is very big. So if she is wetting the sheets, it's probably pee. And if it's something that you enjoy, nothing wrong with that. But it's not... If for those women who don't squirt or those who don't have that squirting effect during intercourse, it does not diminish or make your orgasm better or less.
Okay. Yeah, got it. Here's a WhatsApp.
Good morning, Clement. Good morning to your guests. Clement, I've got one that might be a bit impossible. I don't know how, but please can you ask them, hasn't there been a study on how to get men's contraceptive? You know, even if a man has to have an injection or maybe pills, except for vasectomy. Please, man, I'll listen to that. Thank you. Spike from Lens.
Prof?
Yeah. You're quite right. We've got a dearth of contraceptive devices for guys. Females have many more, and Mpume could probably tell you more about that now. But the thing is, for us currently, it's really just condoms, withdrawal, which is really not very effective. It's really, really hopeless. And vasectomy, which is tying the tubes. Fortunately, we are doing trials on these things. We've been involved as well with one of the the male pill, which is really an injection, not really a pill. And it's usually basically trying to suppress the amount, the sperm count by giving hormones like testosterone. But I think to make it simple so we don't have time, there are things that we're using from the testicle to suppress inside the sperm themselves, things that we're stopping the sperm from swimming. There are lots of chemicals that are trialed for that. We can block the tubes without a vasectomy by using specific gels and stuff. That's also on trial. We can stop the sperm, once they've been ejaculated, from being active inside the female by various things. And then we can suppress the testicles by causing the brain to not send a signal to make the sperm. And those are the basic things, but they're all of them are trial. They're hopefully in the next year or two, we'll have more.
Okay, I've got a minute left here. One person says, Clement, can HSV2 be transmitted via oral sex? And how easily is it to transmit via sexual intercourse? That's a message from Terry in London.
That's herpes. And yes, it can be transmitted. Most of the time, the time where it is most easily transmittable is when a person actually has a lesion. Otherwise, because it stays latent in the body, they don't transmit it when there isn't a lesion. It's when they've got that lesion, herpes lesion, where it is most transmittable. So try and avoid when you do have that lesion. Yeah.
Prof, last one. Please can you ask the guest there, at first when I was having sex, I had an orgasm since I started to masturbate, my penis is numb, it gets hard, but I don't feel anything when I'm penetrating. But when I masturbate, I orgasm and I release sperm. Is anything wrong with me?
If he's trying to have babies, maybe it is. But the short answer, the biggest sex organ is the brain. If you're managing to get orgasm when you're masturbating and not when you're having penetration, you'll probably have to go and see a relationship therapist if you're really looking to have a baby. But if you're comfortable with it, it's also cool as well.
All right. Professor Shingai, Dr. Mpume Zenda, thank you for coming. I'll see you in 2 months.
Thanks for the opportunity.
If you are at work.